Hafaday and good afternoon, everyone. This virtual informational presentation by the Committee on Higher Education and the Advancement of Women, Youth, and Senior Citizens is hereby called to order. Today is Thursday, May 14th, 2020, and the time now is 1:49 p.m. We apologize for the late start, but we're just trying to work through some technical difficulties. For the record and in accordance with Section 8107 of Chapter 8, 5 GCA, public hearing notices were sent out on Thursday, May 20th, adhering to the 5-day working notice, and a second public notice was sent out on May 11th. In addition, this virtual information presentation was noted on the legislature's website at guamlegislature.org. Joining me for today's informational briefing, we have Speaker Tina Munya-Barnes, Vice Speaker Talina Nelson, Senator Kelly Marsh-Titano, Senator Pito Terlahi, Senator Mary Torres. We also have on the line our committee staff and legislature staff. And we have Mr. Arthur Sanagostine and his staff from the Division of Senior Citizens at the Department of Public Health and Social Services. Later joining in this presentation, we will also have the Department of Justice. So Situas Masi to all of the senators who've joined me today and everyone who is watching via YouTube and TV. Before we proceed with the items to be discussed during our virtual informational presentation, the legislature does have general rules and conduct that must be followed during this presentation. All must abide by rules of conduct and quality assurance standards. Please keep video on at all times and ensure you are in a room with little interruptions and adequate lighting, specifically to make sure the participant's face is visible at all times. When speaking, please ensure that you are unmuted and speaking clearly into the microphone. Members of the committee wishing to ask questions may indicate via the in-app feature, the chat box. For those presenting during today's meeting, please state your name before speaking for the record. Questions and testimonies shall be confined to the substance or nature of the agenda. Personal inference as to the character or motive of any senator or individual participating is not permitted, and any violations of this general rule will warrant removal by the host. Again, hafa everyone, and I'd like to wish all of our manamku at home watching a happy Senior Citizens Month. We've called this virtual informational presentation in honor of our manamku who celebrate this month to help remind them and their families of the available programs, services, and resources that we have on island. We recognize that this is a very difficult time for all of you, our manamku especially, who have faced the brunt of the impact of COVID-19 and this crisis, both globally and locally. Government partners like the Division of Senior Citizens and the U.S. Department of Justice and other community-based groups help not only to keep our manamku healthy and happy and independent, but also allow them to thrive in their everyday lives. With our senior centers closed at this moment and all celebrations and activities that we were planning to have during this month of senior citizen celebrations, and many programs being administered differently to comply with social distancing requisites, we wanted to bring some information to our manamku and families in the comfort of their homes. We called on the Department of Justice and Division of Senior Citizens to present today so that they may inform the public of the services they provide that promote, maintain, and protect your well-being. At this time, I'd like to call Mr. Arthur Sanagostine from the Division of Senior Citizens. He is the administrator from the Department of Public Health and Social Services. Art, if you can please introduce yourself and begin with your presentation, and we will save all of the questions from any of the senators till the end of your presentation. Thank you, Art.
Thank you very much, Senator and Chairperson Committee on Senior Citizens. First of all, I just want to thank you for having the opportunity to present on our senior services and also for recognizing this month as Senior Citizens Month, and also recognizing that we are going to be celebrating at a later time and things are being done a little differently at this point. But on that note, I'd like to also share with you that I now notice that Mr. Palomo from my division has joined us. And I'll have him go ahead and do the presentation. I will remain online with others from my staff to answer questions at the end of the presentation.
Thank you very much, Art. Okay, Chad, we see you here. Just please state your name for the record and you may begin.
Thank you. I just wanted to test, am I being heard clearly?
Yes, we can hear you.
Okay, great. Thank you, Senator, for the opportunity. Thank you to everybody who is listening, and to for that, again, for the opportunity. My name is Chad Palomo. I'm a program coordinator with the Division of Senior Citizens. And we put together a PowerPoint to allow for people to understand what the division's services are. And if you notice on the screen, it says Title III Aging Programs, Bureau of Adult Protective Services, and Medicare. And so really what that is a title that really encompasses who we are and what we do. And so if I could go to the next slide. Okay, so our mission, we are known as the Guam State Office on Aging, and it is to plan, coordinate, implement, and evaluate programs and services, and to identify and leverage all possible resources towards promoting, maintaining, and protecting the total well-being of older persons, senior citizens age 60 and older, while safeguarding their dignity, integrity, independence, values, and culture. Next slide, please. We do have a vision for the state office, and that is to provide a formal community support system that promotes the independence, integrity, and dignity of all older persons on Guam, while striving to ensure their individual cultural practices and beliefs are respected in a continuous effort to support their desire to age in place. Next slide, please. So what this slide illustrates is it shows the makeup of all of the different partners who we are contracted with the division, and which programs they have. And so what I can do real quick is the Division of Senior Citizens is a division under the Department of Public Health and Social Services. And if we look to the left of the screen, beginning with Catholic Social Services, they have the contract for our Guma Serenidad, also known as the Emergency Receiving Home. And this is a 24-hour facility. And the details for these programs will come as we go along in the PowerPoint. The University of Guam, under the College of Natural and Applied Sciences, has the Preventive Health Program. We are entered into a memorandum of understanding with the Mayor's Council of Guam for our senior center operations and our adult daycare program. The Health Services of the Pacific has 3 of our contracts: National Family Caregiver Support Program, Case Management Services, and our in-home services. We are currently developing our Legal Assistance Services program. And for our elderly nutrition programs, we have SH Enterprise, and they deliver meals to our home delivered and our congregate seniors. And lastly, Kloppenberg Enterprise handles our transportation services. So these are our providers for the fiscal year 2020. Next slide, please. So some general guidelines for a person if they're interested in applying for or being eligible for our programs. And so it's Title III, and you hear Title III as we throughout this presentation. Title III is one of the, I guess, chapters, I guess, under the Older Americans Act. And so we'll explain a little bit more about Title III as we go along. But it's 60 years of age and older. That is the age in which a person can qualify for our programs. The one program that is a little bit different is that the NFCSP, National Family Caregiver Support Program, can actually have a client that is 55 years of age or older. And so they're a little bit different in that instead of being 60, they can be 55. And then we have Adult Protective Services. They can have clients who are between 18 and 59 but they must have a disability, an identified disability. So there are no financial means, so nobody has to pay, nobody has to, all of our programs are free. There are no hidden fees. And so the only other requirement is that a person be living on Guam, of course. And so many times people ask, and when we get phone calls from family members or seniors themselves, they wonder if they have to pay. And the other issue is age. And so we just really want to inform the public and let them know that there's not a lot of criteria in terms of being eligible for the program, and really a phone call to us, and we can help explain that to them, so that the information is getting out to the community. Next slide, please. So Title III, and actually Title IIIB, is also known as the Supportive Services branch of the Older Americans Act. And as mentioned earlier, there are programs under the supportive services. 6 of them fall under Title IIIB, and they're listed on the screen. That's our adult daycare, case management, in-home services, legal assistance services, senior center operations, and transportation services. Next slide, please. So our 3C, Title 3C, is known as the Elderly Nutrition Program, and there are 2 components to it. So people may or may not have been hearing this in the news or around the community. So our services are continuing, all of our 3B services, in a limited or enhanced or reduced way. Our C1 and C2 component, Elderly Nutrition Program, we are still serving meals to our seniors. So C1 would be delivery to our congregate sites, and our congregate sites are the senior centers. There's 12 of them altogether, and the 3 adult daycare centers. And there'll be some slides later on that will show the names of all the centers that we deliver to. C2 is for our home delivered meals, and so these folks, if they qualify, are able to get a meal delivered to their house. Next slide, please. Our other Older American Act title programs are the 3D, which is the preventive health. That's under UOG. Title 3E is our National Family Caregiver Support Program. And then we have Title 7, Ombudsman and Elder Abuse. Again, we will explain more detail as the slides go along, all of these programs. And as mentioned before, they are all under the Older Americans Act. Next slide, please. So the Division of Senior Citizens, this slide is just what we would like to inform people of, and it's a breakdown of the oversight of all of the programs within the Division of Senior Citizens. There are 4 bureaus. There's the Bureau of Program Administration and Program Development. There's the Bureau of Community Support, Bureau of Administrative Support, and Bureau of Adult Protective Services. Without going into too much detail, the boxes below are the different programs or services that each of the bureau is responsible for. And many of the programs that I was mentioning earlier fall heavily under the BPAD program. the BPAD Bureau, and it lists the different programs there. Bureau of Community Support is sort of the information referral and assistance arm of the division, sort of the marketing arm. There are also the Medicare programs within the Bureau. And so there's a volunteer component under here where we have seniors coming in to get counseling for their Medicare health insurance. Our Bureau of Administrative Support, that they handle a lot of our admin issues, customer service, inventory management, financial management, records management, and then our APS services. Again, as mentioned before, they handle issues with abuse. They also have our legal program, and they also have oversight over the Guma Serenidad Emergency Receiving Home and Ombudsman services. So that's a quick snapshot or overview of the division's bureaus and which services are under which bureau. Next slide, please. So a person can register for our programs, or I'm sorry, let me backtrack. They must register to receive services. And this process is essentially what we call an IPR form that has to be completed, an intake, profile, and referral form. All of the different programs that I've mentioned have the capabilities to receive a person's referral, intake, profile, and referral form, and have that, they have the ability to assist in having a person become eligible for our programs. Many times people will call into the division, and of course the division will conduct the IPR assessment. But also, one thing that we want the public to know is that even if you are, let's say for example, interested in transportation services, but you just so happen to call our case management services division or program, they have the ability to assist that person, sort of a no wrong door type concept, where we do not want the senior or the family member to call in and then be turned away and say, oh, you have to call this program in order to receive this service. And so we really want to integrate all of our programs and help people understand that, if you are looking for aging services programs or aging programs, any one of the ones that I mentioned have that ability to assist people to apply for different services. Once they're registered, their information they're in our system. I'll explain a little bit later on our data management system. And if records are, the only time we would probably change it or how long it would be good for is if the record needs to be updated. For example, change in address, as an example. Next slide, please. So what I'm going to do now is the next several slides will go into some detail of all of the programs that we offer within our division. And we'll start out with case management services. They, as mentioned earlier, are under the Health Services of the Pacific, HSP. They are a contracted vendor right now. Next slide, please. So our case management services program, they provide information to older individuals who are in need of medical care, welfare programs, housing, legal assistance, and they also work with APS, Bureau of Adult Protective Services, for victims of abuse. It's not limited to what I just mentioned, but these are some of the ways in which case management can help people. They are what our caseworkers essentially do is they help identify resources, agencies, or programs in the community, and they put together what's called an individualized care plan. And that care plan identifies what the concern or the need is for the older individual. They also will put together a team of individuals who can assist in achieving solutions or the outcomes identified in their individualized care plan. And so our caseworkers, there's 10 of them altogether, work with our eligible seniors. So of course they still have to qualify. Every program that I'm going to mention, they have to qualify for the program. And they work with our seniors, again, to solve or to work towards a resolution for any of the issues that they may have at that time. So the case management services program also serves as the sort of entryway into 3 of our programs: the adult daycare program, the in-home services program, and our elderly nutrition program, the EMP. So people who are wanting to receive any one of those 3 services would have to be identified through our case management services, and the caseworkers would then determine whether or not a person is eligible for those adult daycare, in-home services, and elderly nutrition component. Next slide, please. Our adult daycare services, this is under the Mayor's Council of Guam. Next slide, please. So there are 3, and I on the next slide will show the 3. But our ADC program They provide services to individuals who have been determined to be functionally impaired. They are at risk of institutionalization. And they also provide respite services to families and caretakers of these older individuals. Again, they must qualify or be determined eligible to our case management services programs. And some of the things, or as an example, some of these services they would receive while they are under the adult daycare program are personal care. It's in a supervised, protective, congregate setting. And the services within the program typically include supervised social and recreational activities, training, meals, and services such as rehabilitation and medication assistance. Next slide, please. So as said earlier, we do have 3 facilities. There's one in the Mechechi Center, the Adult Daycare Center in Mechechi, Derito. There's a Gumagina Fleet Adult Daycare Program, and that's located in Wistig Road, and that's also known as our Dementia Center. And then there's the Adult Daycare Center in Inarajan. They operate 7 a.m. to 6 p.m., and all of our programs operate Monday through Friday, except the 10 identified holidays recognized by the government of Guam. There is lunch provided by the Congregate Meals Program. The facilities are ADA compliant. They are staffed by nursing assistants and part-time registered nurses. And our transportation services program provides transportation for our folks who are eligible to the centers. Next slide, please. With the in-home services, they are under the Health Services of the Pacific. Again, this is their second program. Next slide, please. So for in-home services, a person who is eligible can receive up to 208 hours per year of assistance to that frail older individual. These individuals are homebound, they are at risk of institutionalization, and it's due to limitations on their ability to function independently. So really what it is we call it what's called activities of daily living. And if a person is identified where they have difficulty completing those activities, they may qualify for the in-home services. It has to be identified in their individualized care plan. Of course, as mentioned earlier, they are determined to be eligible by our case management program. And some of the services include homemaker, personal care, chore services, and telephone reassurance. So a person who is a client in this program can have a person come into their home and assist with daily chores, laundry, cooking, cleaning, as examples. Next slide, please. So our National Family Caregiver Support Program is the third program under our Health Services of the Pacific. Next slide, please. So under our NFCSP, they offer 5 basic services required by the Older Americans Act. And again, as mentioned before, this program is a bit different in terms of eligibility. They can have a person who is 55, not 60, but 55 years of age or older, be a client, be eligible for services. And what some of the information that services that NFCSP provides are information to caregiver, resources and services available in the community to caregivers specifically. They provide assistance to caregivers, individual counseling, support groups and caregiver trainings. So every year they have a conference. And really what it is it's to provide training and information because many times people serving in the caregiving role, which we have a lot of folks, a lot of families on Guam are the caregivers to an older individual or a person with a disability. And many times they don't have the necessary training, but they're sort of in that role because the family takes care of them. And so this program is designed to assist that and to help sort of ease the burden or make things easier, if you will, with regards to that caregiver role. One of the things, one other service they offer is respite care and supplemental services, a service provided on a limited basis to complement the care provided by caregivers. Next slide, please. Our elderly nutrition program, also known as ENP, the vendor is SH Enterprises Inc. Next slide, please. So our elderly nutrition program, again, there's two components, congregate and home delivered. They provide a hot, nutritious meal for lunch, and it has to meet the minimum recommended dietary allowance for adults established by the Food Nutrition Board of Institute of Medicine of the National Academy of Sciences. So these meals are designed to be low in sodium and cholesterol, and they meet the general health needs of the elderly. Next slide, please. The meals, and this is for congregate, so the first component, this is C1. The meals must be delivered between 11 a.m. and 12:30 to the site, and those sites are listed below, the 12 senior centers and the 3 adult daycare centers. And this is for folks, of course, who are attending the centers, senior centers, and for the folks who are eligible for daycare services. Next slide, please. For home delivered, or our C2 component, the times differ a little bit. They must be, the meals, delivered to the residents between 10 a.m. and 12:30. A couple of requirements that we have of our vendor is that when they do deliver, they have to see, actually physically see, if the older individual is at home, or if not, they have to make approved arrangements by our case management services. And the reason for that is we want to make sure a lot of our individuals, our seniors, stay by themselves. They may or may not have difficulty physically and have certain ailments. And so we just want to ensure their safety and health. They must at least physically see them 3 times a week. And in the event of an impending typhoon or declared disaster or emergency, up to a 3-day supply of dry goods can be provided in lieu of the hot meal under this program. Next slide, please. Our senior center operations is under the Mayor's Council of Guam. Next slide, please. So our senior center operations, also known as SCO, is designed to maintain or improve the well-being of older persons through the provision of necessary services and activities in the community. Such activities focus on physical, social, psychological, economic, educational, recreational, and the creative needs of the older persons. Next slide, please. Our senior centers, as you've seen in a couple of slides before, all the centers are in compliance with ADA, and we have centers in Agana Heights, Agate, Estumbo, Dedido, Inarajan, Mingilao, Maritzo, Sinahanya, Santa Rita, Tamuning, Jigo, and Jonya Talafofo is actually a combined center. Their operating hours are 9 a.m. to 4 p.m. And they may and can coordinate evening and weekend activities. Next slide, please. And I just, if I may pause for a second here, Senator, if I'm going too slow, or if my time is, if I'm coming close to time, if you could please let me know. Or is there an opportunity if somebody has a question? Of course, please ask. I just wanted to make sure that I'm sort of on track with time, or I'm not going too fast.
Sure. Thank you very much, Chad. Maybe if you can wrap it up in the next 10 minutes, that would work, so we can give time for the senators to ask questions.
Okay, sure. So our preventive health grant program, is under University of Guam. Next slide, please. And so the preventive health, this is programs operated, it's conducted and delivered an evidence-based program, and it's through our Health and Human Services, U.S. Department of Health and Human Services. So it is a Tier 1 evidence-based program identified to be. And the program we're currently using is the ALED, or Active Living Every Day. This program It focuses on physical activity and diet. And what the university does is they communicate with the senior centers. This is where the program is being conducted. It's a 12-week program, and the class size is 10 to 20. So up to 4 months, and identified at different centers. Next slide, please. Transportation services, this is under Kloppenberg Enterprise. Next slide, please. So TSP they transport our eligible clients on a fixed or non-fixed basis. Clients are 60 years of age or older, as mentioned earlier, and a client can be accompanied by a personal assistant or a family member, escort, as long as they are identified, and they must be approved, but they can accompany them. And usually transportation services, they provide to our congregate sites. They provide hemodialysis transportation and our daycare centers. They also provide transportation if a person needs to go to an appointment. Of course, they ask that they schedule it in advance, at least a week, so that the transportation program can have enough time to accommodate their schedule, their transportation schedule. Next slide, please. Right now, our legal assistance services is in development. Next slide, please. The services that are offered, they can provide legal advice and representation by an attorney to older individuals with economic or social needs, and they can provide counseling or other appropriate assistance by a paralegal or a law student, as long as they're under the direct supervision of an attorney, and counseling or representation by a non-lawyer where permitted by law. Next slide, please. Ombudsman services. This is operated under the Adult Protective Services Bureau of the division. Next slide, please. The Ombudsman acts as a liaison to several different long-term care facilities, the adult daycare centers, St. Dominic's Senior Care Home, and the GMH Skilled Nursing Facility. They act as an advocate between the resident and the facility itself in terms of hearing what residents have to say, and if in the event possibly having to advocate on behalf of their rights and resolving any concerns. Next slide, please. This is the Aging Disability Resource Center is our web-based database and information system. Basically, what we do is all of our clients identified in our programs are inputted into the system. All of our programs have access to it, and this is where we gather our data, or is inputted, I'm sorry, and it's all integrated, and so we can go in there and we can search for clients and identify which programs which services they're receiving. Next slide, please. We have a Medicare assistance program under the division. Next slide. So what the Medicare program does is we can schedule counseling services for persons who have Medicare questions, or for people who have the health insurance Medicare. And we work with our volunteers. We have a volunteer component. There's 7 of them, and they assist in providing information and calling Medicare itself to assist our Medicare beneficiaries on Guam. Next slide, please. The Senior Medicare Patrol, it's another program under the division. Next slide. Medicare Patrol focuses on the protection, detection, and reporting of Medicare errors, fraud, and abuse. And so if anybody out there who thinks that they may or may not be victim of it, or they have a question about a call that they received regarding their Medicare health insurance or mail, they can call our division and we can assist under that this program. Next slide, please. Our Adult Protective Services is under the division as well, and I can explain a little bit about their bureau. Next slide. So they are mandated under Public Law 31278 that establish actually the Bureau. They're responsible for receiving and investigating reports of suspected abuse of elderly and adults with a disability. And so also they operate or have oversight, of Gumastan and Adult, the 24-hour, 7-day-a-week shelter. And this is for individuals who have been determined to be in immediate danger. Next slide, please. So this is basically just a real quick information on when to report. If a person has actual knowledge or reasonable cause to believe abuse exists or someone has died as a report of abuse, they can call us up, verbally report it, and then submit a completed written report to Protective Services. In all other events, life-threatening emergencies, we ask that people call 911. Next slide, please. A person can report their name, or they can be anonymous. They must provide the alleged victim's name, alleged abuser's name, and information regarding the nature and extent of the abuse. They can call our division for that to give that information. Next slide, please. Under COVID-19, the division has expanded some services, and that includes increasing our meal capacity from 880 to 1180 for our home-based and drive-through pickup at the 12 senior centers and 3 adult daycare centers. This is under the congregate side of the house, the C1 component. We are also looking to possibly expanding to weekend services and supplying or providing through some of our CARES Act and FFCRA monies, other services related to nutrition. Food commodities, we were able to provide a one-time, in partnership with DOE, we were able to provide one-time delivery of congregate and homebound clients. It was around roughly 2,400 of these food commodities to our seniors. Next slide, please. We do also offer our senior services program, and this is a partnership with HSP, where we wanted to assist eligible seniors who need assistance with banking services, grocery runs, prescription refills, utility payments, and mail pickup. They must be 60 and above, have little to no familial support, and no access to transportation. Coordinate information regarding aging services. What we want to do is we want to make sure that we keep up to date and abreast and track any information and inform the community of any expanding, changing, or new COVID-19 information. And so we really want to make sure if there's a change, something new, that we let our seniors and our community know about it. Next slide, please. This last slide shows all of the divisions identified monies that we've been awarded or been provided under the Family First Coronavirus Response Act, FFCRA, and the CARES Act. And so it includes monies for our C1 congregate, C2 home delivered meals. It includes monies for our Title IIIB supportive services programs. It includes monies for our NFCSP, National Family Caregiver Support Program, and our Ombudsman program. And we've also been awarded an ADRC, NWD Critical Relief Funds a grant and we are working with our partner, the Guam Cedars, with regards to that grant. All totaled, it's about $2.9 million that we are currently working on to ensure these monies go back to our seniors, and we are working on programs identified and services identified to assist under the COVID-19 response. Next slide, please. Any questions?
Thank you very much, Chad, for that presentation. If any of my colleagues have questions, I'll just go down the line. Vice Speaker Nelson.
Thank you, and I want to thank you, Chad, for all the work that you've been doing to support our Manamco during this time. It's just a concern that the care being given to protect the Manamco from abuse and also to protect them from many of the health issues that they'll be facing. Is there someone out of your office that continually reaches out to our Manamco to ensure that they are safe and they are being provided for during this time?
Yes, thank you for that question, Senator. Yes, we do. Our Adult Protective Services Bureau, or branch of the division, we are currently staffed with one social worker and one social services supervisor, and they actively and currently look for and respond to any of the abuse concerns, questions related to legal services and the protection of our seniors and adults with disabilities.
And then also perhaps if some of them need medical care, do we have the services to provide for them transportation? Or do we wait for them to call on us? So, like what I'm saying is, on a daily basis, do we reach out to our Manamco and ask them how they are doing, or we just wait for them to call on us and see where we go from there?
Sure, I think maybe Art can also.
Yes.
Yeah, good afternoon, Senator. Vice Speaker, yes.
Hi, Art. Thank you.
Hi. We actually have several steps in place. One is that with our case management and other programs, we have telephone reassurance. So they do call out their clients to check in on them. The other component in the case management program is they've done a coding system. So the clients that are in greatest and highest risk, they're code red, and so they check in on them. And as we discussed, or I shared with you during the oversight, we're exploring telehealth. And although it's not in place and it doesn't actually answer your full question today, but I do want to share with you that we are looking forward in terms of what we can do with the COVID-19 money, to put something in place in the coming weeks or months, and then using it also for the future. But there is telephone reassurance being conducted through the various programs. And also through the nutrition program, through the drive-through process, they're able to check in with the families and friends who are picking up the meals. A few of our seniors, although we highly encourage them to stay at home, they want to be a part of the drive-through, so they do actually drive through the drive-through. And, we're like, please be safe, take care of yourself. And then we also have our partners that I shared also with you on the oversight last week, Friday. And this mask is slipping, excuse me. And in that process, they are also seeing the families or the seniors themselves, and they're checking in that way. So there is some periodic, regular checking in of our clients through our contracted providers and through the way we're doing the work that we are doing today.
Thank you. And, I'm also concerned for some of our Manamco with limited mobility. Perhaps some of them stay home all day. They don't really get any exercise, or they might need some assistance to walk around if they would like to walk around, or do some simple stretches, because, I've heard, I've heard sad cases where sometimes the children just leave their parent, in the house for a day or so and really don't really check on them. Is there someone there that, reaches out to them and perhaps can provide them with, some kind of resources and some kind of assistance so that they can walk around and, get some fresh air? Because during this time, right, we see it if our Manamco are a different generation, and so they like to always be out and about. They don't like to sit idle, and so I see the demand of this COVID response is many of them are staying home and many of them are idle, and so it's just it's easy to get into a state of depression or helplessness. So, I'm just concerned about their mental health and their physical well-being.
Absolutely. And if I may, Committee Chair and Vice Speaker, we'll definitely share that concern with our in-home services. We are still providing in-home services, and so we'll definitely keep it open for them to understand that during COVID-19, if a senior's request for in-home is to get some fresh air, to be assisted to walk outdoors and just be still maintaining social distancing the best they can and wearing PPEs, protective personal equipment, that we would definitely encourage that. And we haven't finalized this aspect. We are, as Chad mentioned, have partnered with UOG, and they have an exercise pamphlet that they're finalizing that we're reviewing, and that is going to be distributed to our homebound seniors. So just kind of remind them to stay healthy and active during this time while they're at home, but at the same time maintaining social distancing to protect themselves for their best interests. But we'll definitely share that, Madam Vice Speaker, with our provider for in-home services and our other providers.
Okay, thank you, Art, and thank you, Chad, and thank you to all of your team members there. We really appreciate the support you give our community.
Thank you, too. Thank you all.
Thank you, Senator.
Thank you, Vice Speaker. Senator Kelly Marsh-Titano.
Sintuus Mahasi, Madam Chair, and Sintuus Mahasi to everybody being here. It's really important. I know a lot of us are very interested in finding out what's going on with your programs to make sure that we're doing our very best to take care of our Manumco at this time especially. And based off of the very important concerns that were just expressed by the Vice Speaker, I am wondering if there's been any outreach with PBS. They're doing PBS with GDOE for a university, and maybe there's some sort of outreach or working together between these programs and the Manumco to help them with their exercising, or maybe some of the lack of contact and have something that's more geared to them. So I'm not sure if something like that is going on, or if I accidentally missed its discussion.
Yes, thank you, Senator. I'm sorry, go ahead, Art.
No, go ahead, please, Chad, go.
It's definitely a great suggestion, and in the past we have had, in the past and right before actually this response, we were in communication with PBS on a separate activity, and that's actually our Senior Citizens Month for the month of May. And it's I guess coincidental that you bring it up, because we were looking for a way to respond to and assist in getting the information out to our seniors and celebrating certain events. In light of COVID, because we may or may not be able to gather and congregate in large numbers, we were looking at ways and avenues to get that information out to them. In terms of a response, or in terms of getting the information out, currently we have not communicated yet with regards to specifically to that. What we do currently do, of course, is we, as mentioned earlier, we look for information available in the community, changes, updates, and through our information component or information services side of the division, we do provide press releases. There are, and we do work with our partners to actually get together and to communicate with our seniors these types of information. And I'm sure Art can add a little bit more to some of that.
Thank you, Chad. Thank you. And if I may, Madam Chair, Senator and Vice Speaker, and to Senator Marsh, that is a great idea. And as many of you know, we got our COVID-19 money not too long ago, and we'll definitely put that as a potential project on the list of projects. The staff have all been assigned to put projects together respective to the different funding streams. And I reviewed some of the projects just yesterday, and one as recent as this morning. And so on Monday, they're going to be presenting their final proposed projects as to how we would use the COVID-19 funds to continue services, to expand services, or to provide something perhaps like what you just suggested and recommended, working closer with PBS, revisiting with them a partnership in which perhaps we can put forth some media information. With the ADRC No Wrong Door grant, we are actually partnering with the UOG Cedars. And one of the components in that grant is actually to put video together to talk about access for services, especially because one of the areas that we'll be looking at is the change in workforce, the current workforce, how they're doing business, and are there any emerging new workforce and new steps in how business will be done in the new normal And so we'll be working with them as well. But definitely we'll look at the idea, explore the idea of PBS in terms of perhaps exercise at 6 with the seniors through PBS. But Chad is correct. We did reach out to them. In the face of COVID-19, we thought, well, gee, maybe we could do the centenarian celebration all via PBS. That just, with all the changes and us responding as a division, with the staff of 11, our resources were always shifting to making sure food got to the seniors, transportation continued. And so Senior Citizens Month is still being planned when things or P-Core changes so that we can have some reorientation to what the new normal will be, if I may. And we will definitely work with PBS and reach out to Ina Crease again one more time. Thank you for that recommendation. We appreciate it.
Seduce Masi for those answers. It sounds like it perhaps has some really great potential, and technology is different amongst different households and different age groups, and even within those age groups. But TV might be one of the more broader ways that people can access things, and maybe some re-envisioning of how to have them interact with each other and celebrate these really important things during their very special month. Hopefully something can be worked out towards that. And my other question, if I may, before I have to leave to another Zoom meeting. So you mentioned the $2.9 million that's coming to assist, and we're so incredibly grateful for any federal monies like that that are helping out our community, and especially these really important sectors of our community that need as many services as they can get, which there are quite a few actually, but it's so good to hear that they're getting to our Manumco. Are there any other funding that you're aware of that might be coming your way? Anything that's been talked about as a grant, or maybe one of the other, I think there's a HEROES Act that's going on now, something else that might be in the works?
Right on the top, I'm sorry, if I may, Madam Chair. To your question, Senator Marsh, right at this point, no, I am not aware of any additional grants, but I do want to share with you that we have, through these past months, been working very closely with our bi-regional administrators, and we get, if not weekly, daily emails from them informing us of any potential grant or opportunities that may come our way that would assist seniors. And so as those pieces of emails are reviewed, and if there is additional opportunities, we will assure you that if we can, and depending on the manpower requirement, because I have a staff of 11, today 10, because I went as detailed over to contact tracing. We will definitely do our best to secure those grants. The ADRC No Wrong Door grant allowed us to hire 2 individuals, and that they would allow us to hire 2 individuals, but they would be limited term staff because it's not a continuing grant. It's a grant that is being funded in response to COVID-19. So if the grants allow us to do that, then definitely we can do some hiring to help us ensure those grants are managed properly.
Seduce Masi for that, and Madam Chair for the questions, allowing me to ask the questions.
Of course, thank you very much, Senator Kelly. And now Senator Pito Terlahi.
Thank you very much, Senator. I just want to recognize, I just want to thank Art and Chad for the things that you're doing. And wow, man, that's a lot of different services and responsibilities and activities and programs that you guys are handling. So I'm pretty sure that in the future, you guys might need, with so many programs that you guys handle, you might need our assistant to maybe give you additional people to help out with the programs that you guys have. Thank you very much, and thank you for your service.
Thank you, Senator. And although I'm wearing the mask because I have staff who couldn't connect on the link, but we took care of it. They're here. I'm smiling because yes, we would most definitely, and the Madam Chair knows this, we would most definitely appreciate your support for additional staff for the Division of Senior Citizens.
And I'll tell you what,
wholeheartedly welcome that and support it. Thank you. So,
All
Madam
right, you
Chair,
got my support.
thank you so much, Senator.
Thank you. Thank you, Senator Pito Terlahi. Senator Tello Tidegui.
Kajus Masi, Madam Chair, for the
Sure.
opportunity. And I too, Art, I just want to thank you so much, and Chad, for your the information and the presentation you provided. Madam Chair, I'm trying to look online to find out if we had this PowerPoint presentation. Was it forwarded to our emails? If not, then I request that it be forwarded to our email.
Yes, of course.
I'm
We'll send it to you.
Okay, I appreciate it, because I did use my iPad to take some pictures of some screenshots on there, and most particularly the funding source area. And Art, I've heard you in the past that you do need some help in your department, and I believe that what you're doing is very, very, very important. We're a culture that believes in taking care of our manamko. And I'm glad that you're doing a great job there at doing that. So again, thank you again, and Chad, for your help. And thank you, Madam Chair, for the opportunity. I look forward to looking at those, the presentation as well.
Yes,
on
thank you,
our
Senator Tello. Yeah,
PowerPoint.
yes, no problem. I believe the staff forwarded it to you a few minutes ago. So if you didn't get it, we would be glad to resend it to you. Okay, Senator Mary Torres.
Thank you, Madam Chair. I just wanted to congratulate you, Art, and Chad on the wonderful work that your division is doing for our Manamco. I was very interested in the legal resources program that you're trying to stand up, especially in light with the heightened elder abuse that has been prevalent in our community. Do you have an expected timeline when you expect that project to, that program to be stood up?
Madam Chair, and to Senator Torres, no, we actually don't have an anticipated timeline at this time. We again are working at the possibility of Public Defender Service Corps being the partner. Recent conversation with their Executive Director, Attorney Steve Fattori. We are revisiting that with his team, and we really see it as an opportunity. We here at the division have looked at the way the program was managed, and we're looking at how we can improve on that design. And so what wasn't present before is that we would ask that the provider focus on education, outreach, and workshops, but also that the clients they would serve would be seniors who meet a certain criteria that would then pretty much paint the picture that these seniors, given their financial situation, their living situation, that they would, in most instances, would never be able to afford an attorney. So they would actually be a very high-risk target population that would then be more than suitable for PDSC to serve, because we would not be competing with a Guam bar, because they just really won't have the resources. So we want to provide them legal services, but it'd be for that group of seniors, not the seniors who own a vast amount of wealth or who have the ability to afford legal services. This would be our high-risk seniors. So that design has been discussed, and we've actually discussed it in-house, and we shared that with PDSC, and we're hoping this time around, because we did try this before with PDSC and it didn't go through, that this time around that they would be more receptive, because we're defining our target group as a target group that otherwise would not have the resources to access legal services. So we want to work with the PDSC so they can work with the Guam Bar for a pro bono, looking at that population in greatest socioeconomic need. And
I think Director Saxon, I'm sorry to interrupt, but I think that where your division can be very beneficial is even as an outreach entity to spread the word about elder abuse, and say for that group that doesn't fit into the high risk demographics, I think that many of your clientele generally could benefit from knowing, what is appropriate, what isn't appropriate, and when you should seek legal counsel or aid. So I think it's a fantastic partnership with Public Defender that you're working on, and yeah, I'm very interested in that. I would definitely support you in any way in that effort.
Well, Senator, thank you very much, and we definitely will need your support in that effort. And you are right, because one of the focal areas we want in this new design is that there would be workshops, legal clinics out in the community at our senior center. I've actually talked to just a very small number of attorneys, and they're like, hey, we could do this, meet on a Saturday, and they can come back a day or two later to get the legal document. It's really not that difficult to do, and we can come out and help you. So we've got a small group of lawyers who said they're willing to help us, and we're going to work with them. But we do need to get a key agency other than ourselves to take on that big task.
Fantastic. I mean, even a state or end of life planning is very appropriate for any
Absolutely,
senior.
absolutely, yes.
I'm a senior. I can speak from.
Thank you, Senator. Thank you, Madam Chair.
Okay, thank you very much for that question, Senator Torres, and Art, for all of the information. I know that we are in the committee, we're also working very closely with the Public Defender Corporation. We introduced bill number 146-35 to establish the Elder Law Center and allow for the public defender to become the Elder Law Center and fulfill this obligation for legal services for seniors. So that's something that we are still working out a couple of issues with in that bill with all of our stakeholders to make sure that we find the right solution. So we are glad that you're very interested, Senator Torres, and we look forward to working together with you to accomplish that. Art, I thank you, and Chad and everyone there in the Division of Senior Citizens for that briefing. As everyone can tell, there are so many different programs that you are administering, that you take care of, and we are very appreciative for all that you do. And we know that you're short-staffed all the time, so the fact that you've been here for several hours to share all of this with us and to let the Manumco at home know what is available to them. And we hope that they are watching, their families are watching, and if they need assistance, that they can contact the Division of Senior Citizens. They can contact our office as well, and we can help point them in the right direction. I know that it's important for everyone in the community to know that these services are continuing, even though we are in this really difficult time and everything's kind of closed. Services are continuing from the Division of Senior Citizens. And so I'd like to thank you all for that. And I know that we plan to have the Department of Justice on to talk about elder abuse and financial abuse to help give some information and other resources. Unfortunately, they were unable to log on, and then they had a court commitment at 3 o'clock, so everything kind of got delayed, but we will try to reschedule with them to have them share that information with the public as well. But Art, can you please go ahead and give all of your contact information from the division, so if anyone at home is watching, they can call you if they have any questions?
Sure. Right here. Okay. So our contact number here at the Division of Senior Citizens is 735-7415 or 7421. Also, they can send us email at biba.seniorcitizens@dphss.guam.gov. Again, that's biba.seniorcitizens@dphss.guam.gov. And our fax is 735-7416. So please, any way you can send us information or inquiry, we'd be happy to take them on. Thank you very much. Thank you so much, Madam Chair.
Thank you so much, Art. And I'd like to thank all my colleagues again for joining me for this informational briefing, and for us to learn more about the programs that are available and how we can connect our constituents to any senior citizen services. And I look forward to working with you, Art, and the division to make Senior Citizens Month happen sometime this year, even though we're not, celebrating during the month of May, that we do something special for our Manumco very soon. And if there are any questions from the public that they would like us to pass along to DSC, or any information that they are looking for, they can also contact our office. The number is 989-2572, or email our office at Office of Senator Shelton at guamlegislature.org. The time now is 2:53 p.m. and this concludes the virtual information presentation for Senior Citizen Services on Guam. Situas Masi, everyone, and please stay safe.
Thank you very much.